Hi everyone. Today I wanted to talk to you about trauma and post-traumatic stress disorder, so you have a general information about what trauma is and what are some reactions or symptoms that we see when we talk about PTSD. We all experience stress in life. That's normal part of life, and some level of stress can be helpful for our functioning. However, too much stress and for too long can be quite damaging and painful. Certain life events can have profound effects on the way we feel about ourselves, we feel about the world, and our emotional life. Events such as war, disasters, accidents, violence, and others are often experienced by our bodies and minds as painful and traumatic. So, what is trauma? A traumatic event is an event that we can either experience ourselves directly or witness. And that event is usually terrifying and involves a threat of life or physical integrity. During traumatic event, we tend to experience a range of intense emotions, such as fear, horror, panic, helplessness, hopelessness, and overall confusion. Some people may experience derealization and depersonalization, as if they're no longer a part of their bodies for a period of time, or they may feel like as if the event is not really happening. Trauma can take away our sense of grounding under our feet and leave us feeling really angry, confused, and sad. Most people who go through traumatic events tend to recover over time. And however, right after the event, for a period of time, they may experience a temporary difficulty adjusting and coping. If the symptoms get worse, last for months or even years, and interfere with our functioning, then we may talk about post-traumatic stress disorder, or PTSD. Next, I want to talk to you about 4 groups of symptoms that we usually observe in someone who has post-traumatic stress disorder. Group number 1 is what we call re-experiencing symptoms. They are about reliving the event. So for example, you may have intrusive memories of the event and may remember what happened even when you're not thinking about it or you don't want to remember. They may come to you through flashbacks, or you might also have those memories that come through nightmares during sleep. The second group of symptoms is what we call avoidance. We tend to avoid things that are difficult for us or traumatic. So as a result, you may try to avoid situations or people or activities that remind you of the trauma. You may also avoid talking about the event. You may avoid crowds, for example, because they feel dangerous. You may avoid driving if you were in a car accident, and so forth. The third group of symptoms is about negative feelings and thoughts about yourself, the world, or others. The way you think about yourself and others may become more negative because of the trauma. For example, you may feel numb, unable to have positive emotions or joy. You may forget about parts of the event or not be able to talk about them at all. You may think that the world is completely dangerous and no one to be trusted. And finally, the fourth group of symptom is hyperarousal, when we always feel keyed up and on edge. You may feel jittery or always alert and on the lookout for danger. You may suddenly become angry or irritable. We also, as a result of a traumatic event, may struggle with sleep, have difficulty concentrating, and be easily startled by loud noises or surprise. So keep in mind that right after an intense traumatic event, most people tend to experience a range of those reactions. That's normal, because when something abnormal and out of the ordinary happens to you, most people start to feel better after a few weeks or months. For some, however, reactions persist. So if your symptoms and reactions are not going away over time, are very upsetting to you, and disrupt your daily life, please make sure to reach out for help and support. Please make sure to reach out for help and support. There are effective treatments for PTSD. You do not have to suffer alone.